Hi, I'm Matt Johnson. I'm one of the therapists at the TCU Counseling Center. And I'm here to talk a little bit about meditation and introduce some meditations that you can use. Before I introduce the meditations, I do a brief explanation about how our mind operates that leads us into practicing meditation. So I run 4 meditation groups per semester here at TCU, and I've been doing that for about 5.5 years now. And something that's really important to understand is most people who haven't meditated before come with the incorrect idea about what meditation is supposed to be or what's supposed to happen. Our mind is what I call the great time traveler. So our mind travels in different places. For example, 3 basic places it travels is to the past. So if you think about any time that you're thinking about what did I do yesterday or what happened last weekend, or maybe in your growing up in your childhood, you had a memory from the past, boom, you're in the past. Our mind travels to the future. So if you're thinking about what you're going to do later on today, or this weekend, or what type of job you see yourself in the future, or your to-do list, what do I need to do later on today? Or worries, how will I do in this exam? Did I get everything done? Will I be able to get everything done? So our minds travel to the future. And then the present is what's happening right here, right now. So our mind travels in and out of those places all the time. Most of the time we're not aware of that. And when we practice meditation, we become more aware of that our mind is the great time traveler and it's traveling in those places. The reason I bring that up, and it's really important to understand, is that when we meditate, our mind will be traveling to those places. Most people think that when you meditate, what's going to happen is I'm supposed to stay focused on one thing. My mind is never supposed to go anywhere. If it does, that's bad, that's wrong, or there's something wrong with my brain. And they come to the conclusion, I just can't meditate. Okay, well, that's incorrect, that's inaccurate. And so that's why I talk about this before we do meditation in the groups that I lead, to explain that your mind will be traveling, and not just your mind, but every single person's mind in the group. So one of the first meditations that I do in the group, at the end of that meditation, I ask everybody, raise your hand if you notice your mind traveling anywhere else. And how many hands go up? 100% of hands, every single time. And I've run over 70 different groups. Every single time, hands go up, because everybody's mind travels in different places. So that's just part of meditation. It's just how our mind operates. The 3 skills that we're developing with meditation, one is awareness. So when your mind does travel, wherever it travels, whenever we're aware of that, excellent. That's exactly what we want to do. So our mind may travel off thinking about our to-do list. As soon as you're aware of that, great. Second is acceptance. Okay? Accept wherever our mind goes is completely okay. There's no right or wrong. Again, it may go to our to-do list. It may go about to worries about an exam coming up. It may go to what we had for dinner yesterday. But that's acceptance. And then the third is letting go and returning back into the present moment. So a variety of different meditations that we do. Sometimes we're focused on the breath. Sometimes we may be focused on different areas of the body, such as the arm or the head or the face. And then we come back to focus on that. So awareness, whenever we're aware. Second, acceptance. And then third is letting go and returning. So what will happen is sometimes our mind may travel off, and then we bring it back. It may only do that 5 times in 5 minutes, or it may do that 25 times in 5 minutes. One way is not better than the other. So for example, just because your mind may only travel 5 times in 5 minutes doesn't mean that that's better. And because your mind may have traveled 25 times, that doesn't mean that it's worse. You actually get more practice when it travels off 25 times. So the most important thing is notice, accept, and then return. Notice, accept, and return. So that's what the process becomes. Notice, accept, and return. Notice, accept, and return. This meditation is called a body scan meditation. I start out with how we sit. So sitting in a chair, feet flat on the ground, hands relaxed in your lap. So we can have our hands open like this, hands on our lap. or hands in a circle with thumbs touching like this. And we say sitting upright with dignity for yourself and for your meditation practice. So that may mean sitting back against the chair, that's fine. Or you can sit with your back off of the back of the chair. Either way is okay. We don't want to sit really stiff. Okay, so the idea of meditation is not to be really stiff, but it is to be upright as opposed to slouching over. Our eyes, we talk about what do we do with our eyes. So our eyes can be open or closed. If they're closed, we want to have them slanted down to the ground, roughly about 45-degree angle, to help prevent any kind of visual distractions. Obviously, if we close our eyes, that would cut out all visual distractions. So it's very common when people meditate that whether it's the longer they meditate, they may be likely to fall asleep, okay, or start to get tired. Typically, if you are falling asleep a lot, it's probably because you're not getting enough sleep at night. So if you do have your eyes closed and you feel yourself getting tired, then you just want to open your eyes and have them slanted down towards the ground. If you're still kind of dozing off, then you may want to try standing up and meditating. So sitting down is not a prerequisite. You don't have to sit down to meditate. You can stand up to meditate. As well as try a different type of meditation. There are a variety of different meditations, movement meditations, which can be very helpful, especially if you feel tired or you feel yourself kind of dozing off. So in the body scan meditation, what we do is focus on different areas of the body. So I'll guide us through, start from the head and guide us down to different parts of the body all the way down to the feet. One thing important to keep in mind is you may notice tension in certain parts of the body, completely okay. So we're not trying to make the tension go away. We're not trying to force it to go away. We're simply practicing an awareness of different parts of the body. So as a side effect, you may notice parts of the body becoming more relaxed. Okay. And then in terms of starting and stopping, we have meditation bells. And when we start the meditation, it'll be one chime, and it sounds like this. And to stop the meditation, there'll be 3 chimes, and it sounds like this. So, keeping in mind that when we do any kind of meditation, including this body scan meditation, our mind will travel off to a variety of different places, maybe somewhere in the future, your to-do list, worries that you have, memories from yesterday or in the past, and that's completely normal. And so when it does, just bring your awareness back. Okay? So whenever you notice that, accept it, and then come back to whatever area of the body that we're on. For some people, when they do the body meditation and body scan meditation, when we talk about afterwards, they may notice that the last thing we remembered was we were on our face, and then all of a sudden, next thing you know, we're focused on the knee. That happens at times. Nothing wrong. You haven't done anything wrong. That's just part of the experience for some people sometimes. So if that happens, then it happens, and just continue on with wherever we're at. So let's start the body scan meditation and getting in a comfortable position. Again, feet flat on the ground, hands relaxed in your lap, and sitting upright with dignity for yourself, for your meditation practice. You can have your eyes open or closed. Again, if eyes are open, just slanted down towards the ground, or they can be closed. And we have the meditation bells. Again, 1 chime is to start, and 3 chimes is to finish. So sitting in a meditation position, and let's just tune into the sound of the bell, following the sound of the bell all the way until it vanishes. And starting out, taking a couple deep breaths, just to center ourselves on the breath. in through the nose, then releasing out through the mouth. And just tuning into the release. Release of the breath, release of the shoulders, and release of thoughts as best you can. And after a couple deeper breaths in and releases out, then shifting our awareness now to the top of the head. And just noticing the top of the head. And just mentally scanning the top of the head, noticing if there's any particular sensations that you're aware of. And maybe there is, maybe there isn't. And then scanning down to the sides of the head, left side, the right side of the head. Once again, noticing any sensations, maybe an itch, maybe some tension, or maybe not. Just seeing what you notice. And then scanning around to the forehead. So from the left side of the forehead, just slowly scanning across to the middle of the forehead, all the way to the right side of the forehead. And seeing what you notice. Perhaps there's sensations, maybe some tension, tightness. And if there is, it's completely okay. And if there is, you can offer that area to loosen up and relax. So we're not trying to force it, not trying to make it relax, but just offer the possibility of the forehead just to loosen up a little bit. Just to let go a little bit. But not being too concerned about whether it does or not. And then shifting awareness now to the eyes. Noticing the eyes. So perhaps the eyes may be moving, or maybe they're still. Just seeing what you notice. Either way is okay. And shifting awareness now to the nose, and the very top of the nose, the bridge of the nose between the eyes. Just slowly scanning down, noticing any particular sensations from between the eyes, scanning down all the way to the tip of the nose, and then scanning down the sides of the nose. And again, perhaps there's an itch, or maybe not. Maybe no particular sensations at all. Just seeing what you notice. And then from the tip of the nose now, scanning down over the end of the nose, all the way down to the area between the nose and the mouth. Observing the mouth. Is the mouth open or closed? Either way is okay. Just seeing what you notice. Is the air coming in through the nose or the mouth? And continuing to the lips. And from the lips, scanning down to the chin. And from the chin, scanning around to the sides of the cheeks. Noticing any particular sensations there. Maybe there's some tension or tightness. Or maybe there's relaxation. Maybe there's a heaviness because the cheeks are feeling relaxed. Either way is okay, just seeing what you notice. And once again, if your mind has traveled off, no problem. Simply, whenever you're aware of it, just accept it and come back to the area of the body that we're tuned into. It may happen once, it may happen several times. No problem. And now noticing the jawline, scanning from the jawline up to the ears, from the ears to behind the ears, around the back of the neck, back of the head, Observing the angle of the neck, maybe upright, maybe leaning forward. And again, there's no right or wrong, simply observing what is happening right now in the present with the body. And then scanning around from the back of the neck to the sides of the neck, to the front of the neck. And bringing awareness now to the top of the back. And scanning down from the top of the back to the middle of the back, down to the lower back. You may notice where the back is in contact with the chair, if it is in contact with the chair. Simply noticing that. You may notice sensations, maybe an itch, maybe pain, or some annoyance in the back. If that's there, you can offer that area to loosen up. Again, just offering that possibility of the area to loosen up. Not trying to force it, not trying to make it loosen up. And then shifting awareness now to the chest, upper part of the chest, below the neck. Scanning down from the upper part of the chest to the middle part of the chest, lower part of the chest, to the upper part of the abdomen, to the lower part of the abdomen. And then shifting awareness now to the left shoulder, and noticing that area from the bottom of the neck to the left shoulder, allowing that area, offering that possibility of that area to loosen up if it's tight. And then from the left shoulder, scanning down to the left elbow. And from the left elbow, scanning down to the left hand. And noticing if the left forearm is in contact with the leg or with the chair. And if it is, just noticing where that is. If it isn't, that's fine too. Continuing to the left hand, noticing the fingers of the left hand, are they in contact with the fingers of the other hand or not? Is the hand in a fist? Is the hand opened up? Is the left thumb in contact with any other fingers? Just seeing what you notice. What's the temperature like of the palm of the left hand? Is it warm, cool, hot? Just seeing what you notice. Then bringing awareness now to the right shoulder. Scanning down from the bottom of the neck to the right shoulder. Noticing that area. From the right shoulder, scanning down the right elbow. From the right elbow, scanning down to the right hand. And just observing the angle of the right wrist. Is it bent? Is it straight? Just seeing what you notice. And observing the right hand. And noticing the fingers of the right hand. Are all the fingers curved? Are they straight? Are they in a fist? Again, no right or wrong here, just simply observing what's happening with the body right now, right here in the moment. And again, if our mind's traveled off once or many times, no problem. Just accepting that that's part of meditation, part of this body scan, and returning back to the hand right now. Observing the right forearm, and noticing if there's a difference in temperature between the inside of the right forearm and the top of the right forearm. Or is it the same? Then shifting awareness now to the right leg, and noticing the right leg, all all the way to the right knee. Noticing the back of the right leg in contact with the chair. Noticing what part of the back of the right leg is in contact with the chair and what part isn't, if that's possible. And if it's not, that's fine too. Noticing the top of the upper part of the right leg may be in contact with the right forearm. And just experiencing where it is in contact and where it isn't. Continuing from the right knee down to the right ankle. Noticing any sensations in the lower part of the leg, the right leg. From the right ankle to the right foot. And noticing the right foot in contact with the ground, in contact with the shoe or flip-flop if you have one on. And all the way to the toes. Just gently wiggling the toes, just noticing sensations in the right toes. And then allowing the right toes just to settle down, not move anymore. And just gently pushing the right heel down into the ground. Perhaps you notice flexion of the muscles in the right leg. And then letting go. Letting go of the heel pushing down. Shifting now to the left leg. Noticing the top part of the left leg. And noticing if the left arm is in contact with the left leg. And if so, where? And if it's not, that's fine too. And then noticing the back of the left leg, where it's in contact with the chair and where it may not be in contact with the chair. All the way scanning to the left knee and noticing the angle of the left knee. And from the left knee, scanning down the left ankle, noticing any sensations in the lower left leg, any tension, relaxation, maybe no sensations at all. Again, just seeing what you notice is going on with a particular part of the body right now at this moment. And then the left ankle all the way to the toes of the left foot. Gently wiggling the toes of the left foot, noticing those sensations. And then you can stop the movement of the left toes. And gently pushing down the left heel into the ground. Again, perhaps noticing flexion of muscles in the left leg. And then releasing. No longer pushing down with the left heel. But noticing the left foot in contact with the ground. And now observing the whole body right here, sitting in the chair, right now, right in this moment. Then bringing awareness back to the breath. Feeling the breath coming in and going out. Feeling the body right here, right in the room. And if your eyes were closed, you can open them and just take it easy, move slow. Don't try to get up right away. Oftentimes we can feel a little out of sorts right when we open our eyes. So we've roughly done that for about 14 minutes or so. 14-minute body scan. So as you feel more in the room, then you begin to get up as you need to and move around. And that's the body scan meditation.